Assalamu alaikum. My name is Dr. Aisha. Today my task is to calculate the PASI score for a certain patient. Before the introduction, first introduce yourself, explain your task to the patient and obtain the consent. Expose the patient properly and examine the patient and calculate the PASI score. How to calculate the PASI score? In the PASI score, we have to calculate the three main parameters. First is the intensity of the lesion. Second is the area of the involvement, and third is the area multiplier, that is constant. In the intensity of the lesion, we have to calculate the three features of the lesion. Number one is the redness, number two is the thickness or induration, and number three is the scaling. So when we calculate or note down the intensity of the lesion, in the redness we have assigned the number 0 to 4. 0 represent the absent redness, while the 4 show the very severe redness. Same in the case of the thickness and same in the case of the scaling. We assign the number 0, 1, 2, 3, 4 that show the absent, mild, moderate, severe and very severe condition. After calculate the intensity of the lesion, we have to add up the three intensity score: redness, thickness and scaling, and for the each of the four body areas. And those four body areas are: number one is head, number two is upper limb, number three is trunk, and number four is the lower limb. So the A1 is the intensity of the lesion from the head, A2 is the intensity of the lesion from the upper lip, and A3 is the intensity of the lesion from the trunk, and the A4 is the intensity of the lesion from the lower limb. After calculation of these intensity of the lesions from the four body areas, we have to multiply these to the constant of these body areas. The constant for the head is 0.1, for the upper limb 0.2, for trunk and genitalia 0.3, and the lower limb 0.4. So we have to multiply A1 into 0.1, that is represent the head, A2 multiplied by 0.2, that represent the upper limb, and A3 multiplied by the 0.3, that is represent the trunk, and A4 multiplied by the 0.4, that is represent the lower limb. After multiplication, we got the B1, B2, B3 and B4. Next step is the area of the involvement that affected by the psoriasis, and